Hello, college first years, and welcome. My name is Gabriela, and my classmates Kristen, Camila, Zara, and I are here to talk about social stress and anxiety during your transition to college. So, what is social stress? This is stress that arises from social interactions and relationships. Distress can be due to many factors, such as the following: social expectations. You're now a college student. Some expectations that might come with that include attending classes, creating your own study schedule, and navigating a new environment. Moving on to social hierarchies, in college there may be some social hierarchies like learning how to talk with your professors in office hours or maintaining professionalism when applying for student jobs on campus. Finally, you'll encounter social norms which differ in that they are unspoken rules, like college fashion, ways to greet friends versus peers in the dining hall, and participating in your college's traditions or superstitions. My group and I will discuss social stress during a student's transition to college, but first, let's discuss the impacts of stress within the biopsychosocial model of health. How does stress impact psychological, biological, and social health? Stress can impact you biologically in two ways. For in the moment symptoms, you might feel an increased heart rate, blood pressure, or sweat glands, a heightened sense of awareness, digestive issues. Essentially, it's preparing your body for immediate action like fight or flight. For prolonged or chronic stress, that can lead to cardiovascular issues, loss or worsening sleep hygiene. And then psychologically, here are some feelings that may arise from stress. You may fear rejection, failure, or the unknown, have a loss of control over a situation, feelings of being overwhelmed or overstimulated by the environment, a general irritability and anxiety. Some contributing factors that might worsen stress can include depression, a history of trauma, high tendency to self-blame, and a low tendency of self-compassion. In terms of social health, we want to ask, what are our students seeking? So you guys are really just wanting to fit in and wanting to find friends. But there are some potential risk factors when your social health is put to the side, and those can include interpersonal relationship struggles, burnout, potential academic performance consequences, substance use, socially withdrawing and isolating, and homesickness. Zara is going to dive into social anxiety.
So, why is it critical to address social anxiety in college? According to the American College Health Association, stress is actually the number one factor impacting academic performance, even outranking the flu, sleep deprivation, or relationship difficulties. Social anxiety is typically considered an invisible disability because it quietly erodes one's well being and capacity to learn. For adolescents and adults, typical lifetime rates of this condition typically range from 7% to 13%. Increase in severity can lead to impairment in daily functioning, leading to social avoidance. Specifically, in an academic setting, this can lead to decreased engagement in classroom discussions and challenges with giving presentations. This engagement can be directly impacted by extreme self consciousness, embarrassment, and rumination. In turn, this can lead to reduced social and cognitive functioning in classrooms. The severity of social anxiety is also correlated with greater likelihood of dropping out, not graduating, and attention difficulties. Research has also demonstrated an association between stress and suicidal thoughts. To deal with social anxiety, individuals may turn to maladaptive coping mechanisms by using substances such as alcohol and tobacco, which may lead to a substance use disorder. Social anxiety is necessary to address in order to prevent a downward spiral towards addiction and depression. Providing interventions and treatment for social anxiety is particularly essential to not only navigate college, but also build professional competence when entering the workforce upon graduation. This is Ginny. In this hypothetical scenario, she is an incoming freshman at Brown University and is planning to major in English. Her traumatic experiences in childhood and her upbringing have led her to suffer from self harm and panic attacks, the latter being a result of intergenerational trauma and family history. Her trauma is also manifested as social anxiety, where constant hypervigilance inhibits her ability to navigate new settings and explore her biracial identity. Going forward, we will be taking a look at some of the best treatments and interventions for Ginny.
One of the most powerful ways to reduce stress during the first year of college is through social connection. Building friendships and finding a sense of community can significantly lower stress levels and increase feelings of belonging. When students feel supported, the intensity of stress tends to decrease. Living dorms, joining clubs, or attending campus events creates structured opportunities to connect with others. For students experiencing social anxiety, these settings can also serve as a gradual exposure. Instead of avoiding social situations, which often maintains anxiety, small repeated interactions, like attending a weekly meeting or introducing yourself to one new person, can slowly build confidence over time. Beyond social connection, daily habits play a major role in how we experience stress. Stress management can be about handling assignments and also about regulating our nervous system. Eating regularly and maintaining balanced meals helps stabilize blood sugar, energy, and mood. When students skip meals or rely heavily on caffeine, anxiety symptoms like irritability and restlessness can increase. Physical activity is another effective tool. Movement reduces stress hormones and improves emotional regulation. This doesn't have to mean intense workouts. Even short walks, stretching, or participating in a sport you enjoy can significantly lower stress when done consistently. Sleep is especially important. Lack of sleep increases emotional reactivity and makes us more vulnerable to anxiety. Protecting a regular sleep schedule, especially during high-pressure times like exams, strengthens resilience and improves coping. Finally, being intentional with social media use can help reduce unnecessary stress. Social media often presents curated highlight reels, which can increase comparison and self-doubt. Becoming more aware of certain contents make you feel, and taking breaks when needed can protect your mental well-being. Overall, small and consistent habits like building supportive relationships, caring for your body, and reducing avoidance can significantly improve how students cope with stress and social anxiety during their first year.
College counseling services can provide adjustment strategies and treatments for social stress for new college students. CBT helps students challenge negative thoughts by teaching them to identify automatic fears, like, everyone already has friends, I'm going to feel left out. Then they learn to question that thought. Is it true that everyone already has close friends, or are other people feeling just as new and nervous as I am? From there, they can replace it with a more balanced thought, such as, it's the first week. Most people are still figuring things out. I just need to start one conversation. After reframing the thought, students take small social steps, like introducing themselves to one classmate or attending one campus event, to test the new belief and gradually build confidence. CBT can include social skills training, practical conversation starters, improving active listening, and developing nonverbal communication skills to build confidence socially. ACT focuses on clarifying personal values and reducing overthinking. Instead of trying to eliminate anxiety completely, students learn to accept uncomfortable thoughts and feelings while still moving forward toward meaningful goals. This allows them to focus on what matters, like building friendships, even when anxiety is present. In group therapy, students hear others share similar experiences, which help normalize anxiety and reduce isolation. It provides a safe space to practice social interaction and build peer support networks. Parents can support their student by shifting from solving problems to practicing supportive listening. Encouraging independence, validating emotions, and reinforcing confidence in their students' ability to cope helps promote resilience and growth. Preparation before college can also reduce social stress. Attending in-person orientation events and connecting with future roommates ahead of time can make environment feel more familiar and less overwhelming. With the right tools and resources, students can successfully adjust and thrive in their new environment. To support Jenny, we recommend a multi-level intervention. By connecting her with an LLC, she can connect with fellow students who share interests, her major, or identity. Cultural clubs like Black Student Union can also serve as a safe space for her to navigate her cultural identity. As an English major, joining poetry clubs allows her to transform her inner rumination and thoughts into creative social outlets. A structural daily schedule is also important for her to regulate her sleep, nutrition, and exercise, especially when she is experiencing chronic stress. Clinically, acceptance and commitment therapy can support her in living based on her values while also allowing her to accept her anxious thoughts without letting them dictate her life. Group therapy can also be beneficial in building connections with peers who share her identity or life experiences.